How do you deal with fake coworkers and poor management? Whew, give me a second. Give me a second.
You'll never meet another person as mentally tough as you in your entire life. And he hasn't.
Hello everyone, it's your girl Florence, and today I am back with some nursing content. If you're new, hello, welcome. Make sure you subscribe and join the family. We're almost at 400 subscribers, so make sure you subscribe and you're sharing this channel with your friends. Today's video is going to be a nursing Q&A, so I'm going to be answering all your nursing related questions. Nursing school, being a new grad nurse, graduate school, MP school, travel nursing, everything. So I posted a question box on my Instagram for my followers to ask me some questions, so I'm just going to go through them and I'm going to answer each of them one at a time. Before I get into the questions, I'm going to give a brief synopsis that also answers some of the general questions that I got, and then I'm going to get into the more specific questions. So as most of you know, I'm a registered nurse here in New York City. I've been a registered nurse for a little over 2 years now. My specialty is in telemetry, cardiovascular, PCU, that's kind of my realm of practice. But I've also worked with COVID patients, I've done vaccinations, I've done swabbing, I've floated to medical surgical floors, but primarily my specialty is cardiac telemetry. I attended Binghamton University where I got my bachelor's of science in nursing. I did do a traditional nursing program, so I did do my prereqs and then nursing classes all at the same time at the same institution. Currently, I'm getting my master's of science in nursing at Chamberlain University. I'm about halfway done with that, so hopefully next year, 2023, I'll be graduated and I'm done with school for the rest of my life, okay? So that's kind of like a brief synopsis, and now we're gonna get into the more specific questions. So the first question is, what inspired you to pursue your master's? So if you know me, I've always been into academia. I love learning. I don't necessarily like the structure of school, but I do like learning. Personally, education is very important to me. My grandmother didn't even have a kindergarten education. So to be in a position that I am able to pursue higher education is something I don't take lightly. Another reason why I pursue my master's is because long term, what I want to do in nursing, I kind of need it. So long term, I want to be a professor. I want to get into academia, and you really can't do that without a master's degree. So in order for me to teach anyone on a bachelor's level, I need a master's degree. And if I want to teach on a master's level, I need a doctoral degree. So I had to go back. The next question is, how do you like being a nurse? Honestly, I love being a nurse in the sense of I love taking care of my patients. I love improving the quality of life with the people that I work with. What I don't like about being a nurse is management. Right now is just a lot going on in terms of like staff shortages, management shortages, just a whole lot going on. So I like being a nurse. I love taking care of my patients. Do I like the external side of things? Anything that's not direct patient care related? No. But I do love being a nurse. I do love taking care of patients. The next question is, how was your fall semester of senior year at Decker? So just for context, Decker is the name of my nursing school at the university that I attended. And to answer the question, my fall semester of senior year was actually one of my best semesters and one of my favorite semesters, because at that point I had become a nursing assistant the summer before, so I just had a little bit more knowledge and a little bit more context. And at that point too, I had been a little bit more comfortable with the nursing program, comfortable with test taking. So at that point I was a little bit more like, comfortable, and I got the gist of things, so I was able to perform much better than I did my junior year. The next question is, how do you fight burnout? This is a really great question, especially being that I became a nurse and went straight in during COVID, at the peak of COVID. Within a couple of months, I was experiencing burnout because I was tired. I was a new nurse being thrown into a pandemic, and it was very difficult. But to fight burnout, take vacations. As a nurse, one of the perks is having a good amount of vacation time, so make sure you're using your vacation time. Make sure that you're not picking up too many overtime shifts. Like, set a limit of how much you want to pick up within a 6-month period and stick to it. You cannot sit here. I know the money can be tempting, but you cannot keep working. Take some time off, take some vacations, travel. The next question is, how do you manage work life as an RN? So balancing life and work is something that I'm still working on, especially now that I'm also in school. So now I'm balancing work, school, and life. And for the most part, I try to really just take time to hang out with family and friends. I'm really big on keeping calendars. I'm really big on time management. I'm really big on just having a little bit of structure. I always make sure that I'm spending time with my friends, because you know what, at this point I cannot come and kill myself. So at this point in my life, I'm gonna make time for enjoyment. So we're gonna have to make it work. The next question is, how do you keep your peace? Seems stressful. I'm assuming that seems stressful is nursing, but I really keep my peace by just practicing self-care. So one of the things that I did do last year was I did get a therapist, and it did make a big difference, because I was able to pretty much just release, let things out. She was able to pretty much like guide me through certain situations, so that way I could just nip it in the butt and keep it pushing. Another thing that I do is I take vacations. I try to travel quarterly if I can. Even if it's just like a mini trip, I try to do that. The next question is, how do you balance being a full-time nurse with grad school? The biggest factor that I think is helping me so far is just the structure of my grad program. So with my grad program, I take one class at a time for 8 weeks each. The downside is that I take classes all year round, so literally from fall, spring, summer, and do it all over again for another year. But the fact that I'm able to only focus on one class at a time has been a really good factor. The next question is, when are you going to take on a travel assignment and travel with me to Cali? Girl, early next year. After Ghana, we out. I promise you. And hold me accountable. Hold me on that, because we out to Cali for sure. Let's get that bag. The next question is, do you see yourself staying in the profession long term? Yes and no. No, I do not see myself as a bedtime nurse long term, but I do see myself in the nursing profession as a professor. The next question is, how do you overcome anxiety? Honestly, this question is a topic of its own. Especially in the medical field, anxiety is a very common thing. We work in an environment of uncertainty. We work in an environment of anything can happen at any time. Over time, as you learn new things, gain new skills, you just begin to be a little bit more comfortable, and with comfortability, you begin to overcome anxiety. The next question is, how do you deal with fake coworkers and poor management? Ooh, give me a second. Give me a second. Nah, I'm just playing. So when it comes to coworkers and management, it's something that I handle very delicately. To be quite honest, in my place of work, I really come with the mindset of my coworkers are not my friends. So of course, I've been very blessed to work in an environment where some of my coworkers has turned into my friends, but those people are my friends and everyone else are my coworkers. So really just separating coworkers from your friends. The thing about the nursing profession is that it is female dominated, and with females comes a little bit of cattiness, a little bit of gossiping, a little bit of fakeness, and honestly it's something that unfortunately as nurses we have to kind of deal with and navigate. So when it comes to those coworkers that I've already established to be just my coworkers and nothing more, I keep it very work related, I keep it very brief, and I really try not to deal with it at all. Now in terms of poor management, honestly, poor management, as much as I try to ignore it, at times it could be very frustrating, because there's nothing worse than trying to get your job done and other people not doing what they have to do. But honestly, when it comes to management, just try to work around it, because 9 times out of 10 your opinions and the way you feel does not really matter to them. So if you could get your job done around what they're doing, just let it go and let them be poor managers. But if you really do feel like the poor management is getting in the way of patient care, you should have a sit down with your manager and just let them know some of your concerns. Obviously the hope is that they receive what you're saying and try to work on it, but obviously if they're already poor managers, they probably won't receive it the right way, they probably won't work on it. But it's still worth a try to just sit down and have a conversation with your managers. And if you feel like you have to escalate, don't be afraid to escalate. And the last question is, what are the pros and cons of being a travel nurse? Personally, to me, the 2 top pros of travel nursing is, 1, not being attached to an establishment, in the sense of you're in places for a short period of time, so you're able to just do what you have to do and keep it pushing. If you are in a situation where there's poor management, fake co-workers, unsafe staffing, any situation that you don't like is short term, so you don't have to deal with it for years and years to come. Next pro is more opportunities. So as a travel nurse, you're able to go different places, see different things, work with different type of patients, work in different hospital systems, and you're able to gain more experience in it, and essentially just boosts your qualifications as a nurse. The 2 cons is just being the new person all the time. So as a travel nurse, because you're new, you're often the first to flow. In some situations you will get the worst assignments, but again, it's not going to be long, it's going to be short. So if you are in a place where it is bad, it's not going to be for long. The next con is just benefits. So when you're a staff nurse, you're getting all the benefits with your employment package. Your insurance, your retirement, all of that with the staff nurse position in one place, and it's already pretty much done for you. But as a travel nurse, you pretty much have to get your own insurance. So you're getting your own dental, your own eye, your own medical, making sure that you're setting up your retirement stuff on the side and doing everything pretty much on your own. Of course, you have the support of your recruiter and your agency, but it's a little bit more independence on your end. And that is all the questions, and that's it for this video. If you have any more questions, feel free to comment down below and I will go through them and answer every single one of them. If you also have experiences or answers to some of the questions that I asked, also keep it down below. Let's start a conversation. Make sure you subscribe to the channel, and until next time.